I always treat Staphylococcus aureus infection, but it keeps reoccurring. I have taken all the medications that the doctor asked me to take. I've even done confirmation tests, but it keeps reoccurring. Or does it mean that Staphylococcus aureus doesn't have a cure? These have been the questions bothering a lot of people with Staphylococcus aureus, and we are going to treat all that today. Welcome to my channel, and today we'll be talking about reasons why Staphylococcus aureus keeps reoccurring. If you keep treating Staphylococcus aureus and it keeps popping up at every point in time, you keep treating, it keeps coming back, this video is for you. Meanwhile, if today is the first time of coming across my video, you are highly welcome. Please endeavor to subscribe to my channel and click on the notification bell to get notified each time I make a new post. This is the Health Clue, and we help you to discover the path to wellness. Staphylococcus aureus infection have been a stubborn infection that have been disturbing a lot of people, especially in their private parts, where you see a lady discharging, having itches, having burning sensations when having intercourse. Then for men, they keep having painful urination and even discharge from their penis. When they go to the laboratory to do a urine culture or a high vaginal swab, the growth will be Staphylococcus aureus. Staphylococcus aureus is a bacteria that lives in the surface of the skin. I know you've been hearing about Staphylococcus aureus being a normal flora of the skin, which is very true. But the moment it finds its way to your private part, it is no longer the normal flora of the skin, because at this point it is living where it is not needed and it is living where it is not supposed to be. So if you visit the laboratory and there is growth in your semen MCS, urine MCS, or high vaginal swab, it is not normal. Take it seriously, because Staphylococcus aureus can lead to several health complications. One of the leading causes of infertility we have in our society today are as a result of untreated Staphylococcus aureus. Yes, Staphylococcus aureus can lead to infertility. There is one thing you need to know: Staphylococcus aureus is not a sexual transmitted infection, but yes, you can still contract it when you have sex with whoever that has Staphylococcus aureus. But when we have list of sexual transmitted infection, you won't find Staphylococcus aureus there. Now you will ask, if Staphylococcus aureus is not an STI, why then do I contract it when I have intercourse? Like I mentioned earlier, Staphylococcus aureus is the normal flora of the skin. If I use a swab stick and culture your skin, you will see that Staphylococcus aureus will grow. It is found in every part of your skin. Now, how it gets to your private part is when you have an unhygiene sex with your partner. Now let's take this illustration. The woman's vagina is inside. The only place you see staph in a woman's body is maybe the outer layer, like the skin layer of the vagina, just the outer layer of the vagina, because the vagina originally has the bacteria that is good for it. Just as Staphylococcus aureus is a normal flora of the skin, the vagina has its own normal flora. The normal flora of the vagina is Lactobacillus species, which gives the natural pH of the vagina and prevents it from subsequent infections. But in the case of a man, the man's penis is outside, and it is very possible that the outer skin layers of the penis will have Staphylococcus aureus resting on it. So sometimes before intercourse, you may not have a proper wash, and if there's a Staphylococcus aureus bacteria resting on the outer layer of the penis, there's every possible means that it can be introduced into the vagina. Then from there, abnormal growth, you start having itching, you start having discharge. That is in the case of the woman. And for the men, for the fact that you've already introduced this Staphylococcus aureus infection into the vagina, in the process of intercourse, it can also bleed into your urinary tract. Then the both of you will start having symptoms. Another factor is fingering. We have bacteria resting on our fingers, and Staphylococcus aureus is not left out. So in that process, you can introduce this bacteria into a woman's vagina. Now let's look at 5 reasons why Staphylococcus aureus infection keeps reoccurring. Number 1, treating alone without your partner. If you go to the laboratory and you were diagnosed with Staphylococcus aureus, it is advisable you treat with your partner. The reason is because when you had this infection, you had a sexual contact with your partner, and there's a possible means that you have introduced this bacteria into your partner. Now, when you go to treat and your partner does not treat, you come back feeling all well, and you have a sexual intercourse with your partner, there's every possible means that you get it back. Then few weeks later, few moments later, you start having the same symptoms all over again. And this will make you feel probably your doctor or your clinician did not treat you well. No, you didn't treat with your partner and you got it back from your partner. That is why it is advisable when treating infections, you treat with your partner. Number 2, treatment without a laboratory result. A lot of you are guilty of this. When you have symptoms, you just go to the pharmacy and you complain about the symptoms. Then medications will be administered to you as per the complaint you laid. There are lots of symptoms of bacterial infection that are similar. So what this laboratory results will help you do is to know the exact bacterial infection you're suffering from, and also know the medications to take that you're sensitive to. That is why we have urine MCS. MCS means microscopic culture sensitivity. So the laboratory results will help you to know the exact infection you're treating, and also the medications you're sensitive to that will help you knock out the infection. Number 3 is not changing your undies. If you have suffered from any of these infections, it is advisable you change your undies. But if you cannot afford changing of undies, sterilize your undies. Washing your undies and drying it in the bedroom does not completely eliminate any bacteria. So if you can't afford getting new undies, endeavor to soak them in hot water and add some drops of Dettol to help sterilize your undies. After which, sun them. Sunlight is a very good cause in killing bacterial infections. Number 4, abuse of antibiotics. Many people have abused antibiotics to the point that they are now resistant to every antibiotic that is administered to them, which is why we advise that you make sure any medication that enters through your mouth should be through the guidance of a medical practitioner. Self-medication is not good. So when your system is used to excessive intake of antibiotics, it will start forming resistance to all the antibiotics you will take. Then now when you have Staphylococcus aureus infection, you start taking antibiotics, it will not work for you because your body is now resistant to antibiotics. Antibiotics is meant to be taken with the guidance of a medical practitioner. Stop self-medication. And lastly, number 5, not following medical instruction while treatment is ongoing. You will get instructions like don't drink while you're on this medication, or don't smoke while you're on this medication. Due to how addictive you are to alcohol and tobacco, you will go ahead to smoke, you will go ahead to drink while you're on the medication. At that point, all these substances will kill the effectiveness of the medication. Then 2 weeks later, you will come back and say the doctor did not treat you well. No, you were the cause of your problem. Staphylococcus aureus is a very stubborn bacterial infection and is so sensitive. So you need to follow every instruction given to you by your health practitioner. Because like I said earlier, it can lead to infertility for both men and women. Staphylococcus aureus have a cure. Probably you've been going about it the wrong way. So with all this I have mentioned, endeavor to avoid them so you won't fall a victim of it reoccurring. And after treatment, endeavor to go back to the laboratory 2 weeks later to check if the infection is still there. If the infection is still there, go back to your doctor. He or she will know what to do. Don't just relax so that it will not cause subsequent health complications. How then can you avoid Staphylococcus aureus infection during sexual intercourse? The only way to avoid it is to practice good hygiene. Endeavor to have a good wash before having intercourse, because like I mentioned earlier, Staphylococcus aureus bacteria can be resting on your penis, and without a good wash, you can introduce the bacteria into the vagina. Another point is endeavor to wash your hands clean. Another point is avoid fingering of the vagina. But if you must, endeavor to wash your hands thoroughly with soap and water. If you have not subscribed up to this point, I wonder what you're waiting for. Thank you all for watching. See you in my next video, and don't forget to subscribe.